Hello, my name is Richardson, and today I'm going to be talking to you about the disorder anorexia. So, just a basic overview about it. It's characterized by recurrent food refusal that normally leads to dangerously low body weight. It's more common in females, but it can be seen in males, and is normally seen in Caucasian females from middle to upper classes. The onset age for this anorexia disorder usually ranges between 13 and 18 and is very chronic, and normally they refuse to seek treatment. About 25 to 30% are below expected weight before they go seek treatment. So that just basically means that by the time they go ahead and seek the treatment that they need help with this disorder, about 25 to 30% of them are already below the weight that they should be. The prevalence for this disorder, 0.3% for males have this disorder, and about 0.9% of females have this disorder. Some of the symptoms of anorexia would be dry skin, brittle nails, bone loss, sensitivity to cold temperatures, and sensitivity to the intolerance of food. This disorder does have several medical consequences that come behind it. Like I said, it's more prevalent in women, so the menstrual cycle does stop. Cardiovascular problems can arise, kidney problems, brain atrophy, low blood pressure, as well as electrolyte imbalance. Theories/causes for anorexia. Some cognitive theories have been proposed for it, and it's said that the Western societies judge the self-worth for the shape and needed for self-control. Also, anorexia could be caused by family members who are also going through this disorder, and they want to be exactly like one another, and they begin to be protective and reinforce rules. Some of the causes for anorexia is being thin is in the cultural imperative for thinness, basically meaning that social media and other like magazines and modeling and all that stuff, they promote being small is healthy and being thin, and if you're not thin, then you can't model or you can't do certain things. There are a few different ways that you can seek treatment for anorexia. Medications are generally ineffective because, just think about it, they have a disorder, so it's going to be hard for them to change their behavior. So if you give them medication and they are responsible for taking it on their own, they're not going to take it. Weight restoration is the most effective and the most easiest way to treat anorexia. And lastly, the behavioral and cognitive interventions. Some additional information about anorexia. As stated in the book, the DSM-5 puts it in two subtypes. One is called binging and one is purging. The BMI on average is 15% for anorexia, which is starvation. Another disorder that comes along with anorexia, or I should say that goes hand in hand, is bulimia. And both bulimia and anorexia are characterized by the fear of gaining weight. The difference between the two is anorexia, you're afraid to gain weight, but you won't eat. When you have bulimia, you will eat and constantly make yourself throw up, which is why they call it purging. When you do have anorexia, it does come with a lot of comorbidities behind that, like OCD, anxiety, mood disorders, and it is said that it has about 71% of people that suffer from anorexia also have these mental health issues that I just listed. In our book, it talks about a lady by the name of Isabelle Caro, and Isabelle was a 28-year-old French model that actually died from anorexia disorder. She died back in November of 2010, and she only weighed 93 pounds. and she was 5 feet 5 inches tall. Her BMI was 1547, which a BMI of 15 or anything is considered starvation. And actually, years after she died in 2015, friends implemented a ban that if you had a BMI that was less than 18%, that you could not be accepted to model. She also, which was very weird, she advertised anorexia disorder and the dangers of it, but she herself was still starving herself. So that just goes to show that social media can have a big influence on having any kind of mental disorder, as well as if you're trying to pursue some type of career, because she was just a model and they wanted her to be a certain size, so she got herself down to 93 pounds to fit in for that particular career. Some ending thoughts that I would have for a person that's suffering from this disorder would be, make sure you get treatment and seek help about this disorder. Continue to reach out to family or friends that can support you and help you along the journey to get you help. Don't be afraid to get treatment. Treatment is okay, and it will help with your disorder. And I would avoid social media, like I stated previously, because social media has a negative connotation about being thin, and thin is in. So if I was someone that was suffering from this disorder, I would definitely avoid all social media.